Greetings, I'm Dr. Kim, the CEO of Leaders Rehab Robot and Leaders Rehab Hospital. Leaders Rehab Robot was established to provide an automated system for neurorehabilitation, satisfying the needs of a wide spectrum of clients, including doctors, therapists, patients, and caregivers. The functions of our system are constructed with an evidence-based approach by adopting real therapeutic exercise. This was developed by a rehabilitation specialist, medical doctor, who is also the founder of my company. Leaders robots have exceptionally novel characteristics given by their unique system and function, focusing on safety, efficacy, and affordability.
Today, I am thrilled to introduce Philip-1. Philip-1. 1 is the upper extremity neurorehabilitation robot. 2 provides easy don and doff with its snug and safe design. 3 is a self-functioning robot therapist modeled after real therapist activities, including evaluation, prescription, and execution of treatment. 4 covers therapeutic exercises for upper extremities, such as wrist and finger rehab, with only one simple system. 5 provides customized rehab based on the severity of disability with passive, active, and resistive mode. Philip has a very simple structure consisting of table and mobile module, which enables comfort suspension with its sole design. The mobile module consists of arm support and a hand module. Generally, it is not easy to hold weak and spastic fingers to the device, but Philip's hand module is an ergodynamic shape for hemiplegic hands for easy fit and comfort. The table is incorporated with an orthogonal robot with a magnet, which holds the mobile module on passive mode. To use, the patient approaches the wheelchair from the front and puts their weak arm on arm support. Then, simply fits one's weak hand on the hand module and fix with cover tightly. It takes less than 1 minute to get on and off the system, requiring only one caregiver or even none. When patients do not have the motor power to move their arm voluntarily, the passive mode of the orthogonal robot in the table will move one's arm through a designated course using magnetic power. If the patient can move one's arm voluntarily, one can use active mode to move the mobile module without any help from the orthogonal robot. Passive and active modes are also applied to fingers. If the patient can move one's fingers actively, the sensor installed on the hand module will pick up the pressure of the movement. Then the hand module will help with the grasp and release movement in active assisted mode. If there is no power on fingers, the passive mode will activate, and the hand module will guide fingers' movement in a designated fashion. Philip enables integrative movement between arm and fingers with one system, even with versatile functions, including passive mode and active mode, resistive mode, all accomplished by its innovative and unique design and function. Philip adopts a real therapist's role of neurorehabilitation, evaluation of residual impairment, the formation of therapeutic plan based on the result, and execution of the therapeutic session. Philip makes it possible for a series of natural movements such as targeting with arm, grasping, and releasing with fingers. Passive mode stimulates sensory integration, while active or active assistive mode facilitates voluntary movement. In evaluation mode, Philip uses the module to identify the severity of functional impairment regarding residual motor power of arm and fingers, based on the ability to make specific movements. The functional status of hemiplegic upper extremity can be one of total of 14 cases. For instance, one can actively move one's arm and grasp the object, but cannot release the object. This case will be interpreted as active, passive series. Regular checkups will show the patient's improvement objectively, and this data will be used to readjust treatment protocol according to the test result by a clinician. Prescription mode enables the medical personnel to prescribe customized treatment protocol according to the degree and intensity of dysfunction based on the evaluation result. Or Philip also has the intelligence to recommend the ideal treatment protocol for you. First, Philip will choose the mode of exercise for each part. according to the evaluation result, passive, active assistive, or active resistive. Then, you can choose specific content and specific movement. The degree of difficulty of contents is arranged based on the residual capability, from easy, moderate, to hard. You mustn't forget to adjust the set and duration as well. Philip's therapeutic mode operates based on the basic fundamental function of the upper extremity. Thus, Philip provides natural and serial movement of reaching, grasping, and releasing. In passive exercise mode of the arm, the orthogonal robot in the table will move one's arm through a designated course, using magnetic power between orthogonal robot and mobile module. In the active mode of the arm, magnetic power will be turned off, and the patient can move one's arm without the help of orthogonal robot in a weak resistance condition, available because of very low friction between mobile module and table. Passive and active modes are also applied for finger rehab. The sensor installed on hand module will pick up the pressure of the movement. Then the hand module will help the grasp and release movement in active assisted mode. In passive mode, the hand module will guide the finger movement through a designated course. Philip provides a variety of content to foster patients' motivation and participation in therapy. This can be as simple as a directive narrative or complex as a fun game or daily activity, such as cooking. More interesting game content will continuously be provided. The performance is collected and analyzed by the system, and then delivered to the therapist or users. You can check whether or not there is expected improvement. If there is dynamic spasticity during arm movement, the mobile module can be easily detached from the robot, avoiding any injury or pain, ensuring safety. This is one of many strong points of Philip's novel system of magnetic-driven mobile platform. After stabilizing spasticity, the robot will catch up with the mobile module automatically. If you have moderate, severe spasticity of a hemiparetic arm, it will be great to use Philip-2 before P1 to reduce spasticity in advance. This will provide much effective and efficient rehab. Philip provides a very real therapeutic option with a reasonable price, providing professional-level performance. It can function as standalone robotics or the main part of the rehab automation package system. I'm sure you will be very impressed with Philip's innovative and comprehensive function, developed by the expertise of a rehab specialist. I do not doubt that the leader's robot will be the standard technology of robot rehab due to its outstanding and unique functionality and safety.